So the next speaker is Dr. Andrew Wong, which is the head of the infection control branch of the Center for Health Promotion in Hong Kong. Center for Health Promotion in Hong Kong is the public health agency of the territory of Hong Kong.
Thank you, Chairman. Ladies and gentlemen, I'm happy to be invited for this presentation to share with you our experience in Hong Kong on the promotion of hand hygiene using the WHO model. And as Sue has alluded to, hand hygiene when compared to acute care facilities in the long-term care facilities is relatively little studied. And Hong Kong is participating as one of the pilot sites for hand hygiene promotion using the WHO model in both acute and long-term care facilities. And I would like to share with you our experience from a more public health perspective. As you know, in the long-term care facilities, it complies care other than the medical care of the patients, of the residents. It also includes social and environmental needs of the residents. So as you can see later on, more and more of these patients are being discharged with multiple complex problems. And they also have devices with them that prone them to multiple infections. So hand hygiene is a core control measures. So I think all of us are very familiar with the 5 steps of the WHO hand hygiene implementation. So I won't go into details here, but suffice to say that it's important to prepare the facilities and evaluation and also follow up and review and continuous planning are also very important. And the 5 components for the multi-model improvement strategies include system change and also training education, evaluation and feedback, reminders in the workplace, and institution of safety climates. And you will see how we adopt these components in our campaign. And this is the well-known 5 movements for the WHO hand hygiene. Before we go into the details of the programs that we have, Before we go into the details, perhaps just a very brief introduction on Hong Kong. Hong Kong is a small area. It only around 1,100 kilometers square. It's in the southeastern tip of mainland China. And so that's why, space is an issue for Hong Kong. And as you will see in the long-term care facilities, we are very short of space. And also, even in the acute care facilities, is always nearly 100% or more occupied. So there's a great pressure for patients to be discharged back to the long-term care facilities. Just a scenery of Hong Kong. And the population of Hong Kong is around 7 million. And as for all developed regions of the world, we are facing aging problems. And as of last year, our population over 65 years old is around 13%, and it's estimated to go over 20% in 10 years' time. But most of our elderly population are healthy and live in the communities. As end of last year, there's around 900,000 residents, 900,000 people over the age of 65, out of which 13% are living in the so-called residential care home for the elderly. Sorry, it's 7% of them. And among these homes, around 3/4 of them are private homes, and the remaining are either government-funded or government-subsidized, and the size of which around 50% of them are over 100 residents, and some of them are really small and have less than 30 residents. And in total, there are around 800 such homes in Hong Kong. As you can see, over the years, one of the main issues with these facilities is the limited manpowers in these facilities. And although the staff-resident ratio here is around 1 to 3, but most of them are healthcare assistants. The nurse ratio is only around 1 to 30, and some resident homes are even not manned by a registered nurse. So you can see the kind of training and the environment that is, the residents reside in can be very different from what is practiced in the Western countries. So, but we are faced with more and more residents living in such homes over the years. And around 15% of the residents are bedridden and is on an increasing trend. And around 9% of them are on tube feeding. And around 4% of them are on urinary catheters. So all these long-term care facilities are regulated and licensed by the Social Welfare Department under the government of Hong Kong. And there's varying types of residential care homes, and with the highest level of care being the nursing home, followed by care and attention home, and the home for the aged, and followed by the hostels. And we have conducted a hand hygiene promotion program in nursing homes as exploratory pilot programs for WHO model implementation in Hong Kong in the year of 2007. So these nursing homes provide care to the most severely impaired level of care for patients, and patients who suffer from poor health or physical, mental disability with deficiency in activities of daily living resided there. And they have the highest level of care, and all of them are government funded. And our study period is for 9 months. We apply the WHO multimodal hand hygiene improvement strategies, and we introduce alcohol-based hand rub at point of care through these homes. And this is the picture. We equip them with the alcohol-based hand rub at, for example, the BP trolley, diagnostic trolley, and isolation room entrance, napkin trolleys, and places where all the healthcare workers can access to when they care for the residents. And we, according to WHO model, we also introduced the pocket-sized hand rub. And we conducted a focused hand hygiene talk and also hand hygiene demonstration to the staff with real-time feedback to them. And because one of the main concerns of these healthcare workers is the skin being dried by the alcohols. That is really common among the ladies' population. That is one of the concerns. But we want to reassure them that this is not really an issue. And therefore, we try to check that the skin moisture level before and after using the hand rub, and found that there's no difference between before and after, and they are reassured. And it's also important to evaluate their feedback, and we conduct focus group to get their feedback from the promotion exercise. And in terms of survey, we follow the WHO model. We do the baseline post 1 month, post 4 months, and to get their knowledge, attitude, and behavior. And we do direct observation to assess the compliance rate on hand hygiene, on the opportunities for hand hygiene. And these are the charts that we provide to the facilities, and so that they can know how good they are doing. And the baseline, the compliance rate is around 45%. And we also break down the compliance rate by the rank and the different moments, so that they will know how good they are doing during different opportunities. And this is the 1 month post-intervention compliance rate increased to 80%, and 4 month post-intervention is 80%. And 1 year we have performed the assessment is around 72%. And we also produced reminders in the workplace in form of hand hygiene posters, and also different cartoons to remind them, and put it at the point of care, and also some folders and rulers for them to use. And one of the important things is the open endorsement and support by the management. And for that, we have organized an hand hygiene awareness ceremony in the year of 2010. And the Director of Health in the center present certificates of appreciation to the participating nursing homes for their participation in the promotion exercise. And for the care and attention home, we also performed a study. And for your information, for care and attention home, they are the second highest level of care. They have only 1 registered nurse per home at one time. And compared to the nursing home, they provide a less severe degree of impairment levels to the residents. And we started the study in 2009 and lasts for around 8 months. And we employed again the WHO strategies, and the intervention arm is both 1 and 2, and they were provided with slightly powdered gloves and powderless gloves respectively. And but that does not concern with the opportunity for the hand hygiene. It's only because when some of these staff, they have concern that when they use a glove and with powder, they may feel the grittiness and don't like to use the alcohol hand rub afterwards. And the practice of using glove is mainly based on the needs. It's not related to the study. So you may regard both intervention arm 1 and 2 as the treatment arm. And the control arm were provided with similar promotion material, but is unrelated to hand hygiene. So learning from our experience in the previous 2 years, we further improved the program by making for example, the alcohol hand rub more accessible to the staff, because one of the concern is when they have to get it from the pockets, sometimes it will make the pocket dirty. So we provide them with such a device so that they can hang it at their belt, so that they can access it anytime. So again, training with real-time feedback on their performance on hand hygiene, because really people tend to believe in what they see. So we think about ways to convince them how good they are doing on their hand hygiene. And one of the ways we use the fluorescent dye, and then they rub their hand, and so that they know how good they rub their hands. And again, evaluation and feedback to the homes for continuous improvement. And this time around, we have some stickers. And the results is that a total of around 1,100 hand hygiene opportunities of observed, with a total of around 330 hours of observations. And the hand hygiene compliance increased from 27% and 22% at baseline for both intervention arm 1 and 2 to 59 to 60% at 1 to 4 months. And compliance in control remained around 20% throughout the whole study period. And both intervention arms show increased compliance compared to control. So these are the different lines showing the compliance over time, and the red line is the summation of all these studies. As you can see, there's an increase in hand hygiene compliance in both arm 1 and arm 2, but at post 4 months, we are not sure why there's a decrease in the powderless glove arm. And for the control arm, it's pretty static over the period. And from the manager and frontline healthcare workers, we get their views. And the main concern is the lack of resources and manpower. And they also agree that there's a need to educate staff, residents, and their relatives about the benefits of the program. And according to the WHO model, there's also a suggestion for a resident participation program, as alluded to by Sue just now. We also explore on that with the managers of the homes. And, but it seems that most managers, it might not be feasible to do so in the settings of our culture. Maybe some of them think that they would like to be reminded by the residents. And so we just know their thoughts, and we would not further pursue with this direction for the moment. The main obstacles are from the residents, staff, relatives, and the cultural. So I'm not going to go into that. So now we are going to do the 1-year post follow-up of these homes to assess the sustainability of hand hygiene compliance. So comparing Hong Kong, the programs with other places, we employed the WHO models and the PEM post. For the nursing home is from 45% to 80%. For the care and attention home is from around 20% to 40 to 60%. And there's the study that performed by Chinese University of Hong Kong that is alluded to by Sue just now for those 6 homes has 25 to 33%. And compared to other places, the hand hygiene compliance in nursing homes are in generally low. So it's important to continuously assess the program, the progress, and plan for step forwards. So for the exploratory phase, we have performed the promotion program in nursing homes and the care and attention homes. And the results show that the promotion program adopting the WHO multimodal strategy was effective in improving hand hygiene in long-term care facilities. So we will repeat the hand hygiene program regularly and coupled with the hand hygiene awareness day. And these are the stickers that we have performed. And we feel that the community has also got a strong participation in hand hygiene. So the government of Hong Kong also has done some work, a lot of work on hand hygiene promotion in the community. And we in Hong Kong have faced SARS and also avian flu outbreak. So in general, the residents are quite aware of the potential danger of infectious disease. So this is a short video that is put on the television, and a 30-second so-called announcement of public interest to arouse the awareness of hand hygiene.
雙手望落乾淨，其實暗藏邋遢。唔洗手，難怪變咗傳染病嘅幕後黑手。所以記住，經常用梘液洗手，用酒精搓手液都得㗎。勤洗手，咪做幕後黑手。
Oh, okay, that's quite funny. And for the, I won't go into that. We have also got some materials on the website, and in the Hand Hygiene Day, we have a congratulatory message from Dr. Margaret Chan and Sir Liam Donaldson for our achievements in the both acute and long-term care settings. And coupled with the World Health Day theme on the antimicrobial resistance, we tailored our posters on use of hand hygiene for control of MDROs. So the way forward is how to maintain the sustainability of hand hygiene compliance in long-term care facilities. I think the obstacles mainly are resources in form of the, because most of these homes are private and profit-making with limited resources, including money and manpower, and also coupled with that, a lot of these healthcare assistants, they have high turnover rates, so that although we have annual training for them, so next year maybe another batch of people. And space is another issue, and a lot of these facilities don't have single rooms. They are just open space with some partitions. And people are getting sicker and sicker because of the chronic medical conditions. And also sometimes the attitudes of the public are not conducive to, for example, they may not be willing to pay for increased costs for improving hygiene for these private homes. And also the management, for example, the licensing authority and the operation manager have to be work together. So we have organized a coordinated meetings between all these government departments to coordinate the actions, and also include the audits. All the checklists will include hand hygiene as one of the key components for licensure, so that it is more effective. And our lessons learned for the past few years in promoting hand hygiene in long-term care facilities
is some of the success factors include strong political commitment, including open endorsement of health authority and license authorities, and also include the inclusion of audit checklists with hand hygiene, and structured training programs in evaluation, support of managers, and increased awareness of general purpose. But overall, I think hand hygiene is only one of the components for control of infection in these elderly homes. And we believe that a multifaceted approach, including environmental approach, environmental cleanliness, hand hygiene, and also device care, and education and training and audits are important. But what is the minimum that we have to do? I think further studies is really necessary. And with that, I thank you for your listening. And I would like to acknowledge the following people: the Infection Control Branch, Dr. Janet Ho and her team, and participating nursing homes and care home, and also the Elderly Health Service of Department of Hong Kong. Thank you very much.
Thank you, Dr. Wong, for this beautiful work.